Thank you for joining me. Today we're going to cover the 6 critical points in treating Lyme disease from the thousands of patients we've treated over the last 15 years and several papers that we've published. I'm going to share that information with you quickly to why Lyme disease patients do not get well typically. Okay, number 1 is getting the correct diagnosis, which means you might get diagnosed with Lyme disease, but are you being tested for all the other infections, viral, fungal, parasitic? Because if you don't treat all of the infections, you don't clear all the symptoms and you don't get the improvement that you want. So that's very important. Also, you'll get a lot of false negatives. So it's important that you know and get the right testing with a Lyme literate doctor. That's very important. Number 2, multi-drug resistance. We published in 2014, Borrelia is one of the most complicated bacteria to treat in the world. Its genetic shifts, its antigens change, and so what does that mean? That it's multi-drug resistance. It doesn't respond to medications. You'll get a little bit of improvement, maybe 30, 40, or 50% or even more, and then the disease returns again, becomes resistant to the antibiotics, resistant to the medications, and that's true of some of the co-infections as well. So you need to treat the multi-drug resistance so that you get the long-term benefit of the care. Number 3, chronic immune issues. Patients with Lyme disease have weak immunity, and weak immunity causes opportunistic infection. So you pick up all other kinds of infections. In addition to that, your own immune system can start attacking your healthy tissue, which we see in autoimmune diseases, which can be very much caused by Lyme disease. And so we see weak immunity and hyperimmunity coming from this infection. Number 4, the blood-brain barrier. If Lyme disease or its co-infections are in the brain, in the central nervous system, and they are impacting tremors, depression, anxiety, mood changes, you name it, all kinds of things, even seizures, you need treatments that pass the blood-brain barrier effectively and safely treat those infections. That is something that we see that is commonly not treated and why the neurological problems do not clear up. Number 5, endotoxins. This is what Borrelia produces. The infections and other infections, they produce an endotoxin, a bacterial lipoprotein that blocks nerves and hormone functions in your body. So your nerves are off, your hormones are off. They're not able to hit their receptor sites, and they need to be flushed. The endotoxins like to kill nerves, kill organ tissue, so it needs to be flushed out of the body properly. If not, the symptoms do not improve, and that becomes very critical. And number 6, biofilm communities. If you take a look here at this image, you'll see like a sludge surrounding all these infections, like a matrix protecting it. So the antibiotics bounce off, the immune system can't penetrate. You need to be able to strip the biofilm communities so that the other therapies are more effective. Now, this is just a quick review of these 6 essential pieces to treating chronic Lyme disease complex. We've been treating patients for the last 15 years, thousands of patients, the most complicated cases, and published several papers in the subject, and these are the things that patients need to really get their health to the next level. If you have any questions, we're here to help you. We have lots of educational materials for you. Please don't hesitate to reach out. We're here to help you. May God bless you on your journey to healing. Thank you.